In about 2003, after the Columbia accident, the agency looked to develop what's called technical authority. So at that time, that was, as I said, in response to the Columbia accident, and it was felt that given what had occurred at the time of the accident, that the agency had to adjust its management structure where there could be an independent oversight of particularly programs and projects. Programs and projects typically have a lot of pressures on them from regarding to costs, schedule, and just engineering development. And it was felt that issues that are associated with either engineering or safety or other aspects of the program or project needed to be looked at by an independent organization that was not under those pressures, particularly cost and schedule pressures. So if something wasn't perhaps going the way it should be or developed the way it should be, there could be an independent voice that could say that there needed to be an adjustment without having to rely on the pressures of cost and schedule. So at that time, the agency was trying to figure out what would be the best way to organize sort of this independent authority that would look at the programs and projects. And a lot of ideas were floated. In fact, they talked about at one time having a technical authority for information technology, a technical authority for legal. But then it was finally decided that they really wanted to focus on oversight of programs and projects, and that the three main technical authorities that should be developed is obviously engineering, safety, and mission assurance. And then it was also felt, particularly for human spaceflight, that there needed to be a separate health and medical technical authority. Since the health and medical organization within the agency, the Office of the Chief Health and Medical Officer, as well as at that time the Life Science Directorate at JSC, really was the organization that was responsible for looking at health and medical and performance issues associated with human spaceflight and for human rating. So they finally settled on the three independent technical authorities. Now, what was interesting is that at about the same time that the technical authority concept was being developed within the agency, within the health and medical community at NASA, there was a feeling that there needed to be a closer interaction between the biomedical research that's done at NASA, as well as the actual operational medicine and operational oversight of the programs and projects, and that the focus of that activity needed to be more operationally focused. When I first came to NASA in the 90s, when we were doing the life sciences research program, the biomedical research, while it was focused on issues associated with human spaceflight, was a more kind of open program and looking at almost being run like the National Institutes of Health, where they get into a lot of broad areas, sort of but with the foundation of trying to support astronauts in space. At about the same time that we're talking about, the idea was beginning to be floated and thought about that the biomedical research really needed to be very operationally focused, and that the effort had to be focused on looking at what are the health and medical and performance risks in human spaceflight, and really trying to solve those risks and develop countermeasures for human spaceflight. And that coincided very well with the whole concept of technical authority, because the way technical authority works is that the technical authorities, engineering, safety, and health and medical, develop the appropriate standards that a program or project needs to meet either engineering, safety, or health and medical issues. So the idea of that health and medical technical authority would have to develop health and medical standards fit very well with the idea of really focusing the agency's research in health and medical issues into the area of a very operationally focused activity that then could help drive the development of the standards. And those things were happening at the same time. I think part of that was when the Constellation program was first developed, again at about after the Columbia accident, and the focus really was going on for focusing to space exploration beyond low Earth orbit. Um, like I said, the health and medical community really started thinking that it need to be framed more operationally than as just a science activity. And that coincided very nicely with the development of technical authority. So where we are today then is that this Health and Medical Technical Authority, the Health and Medical Technical Authority, which is the Office of the Chief Health and Medical Officer, we have our health and medical and performance technical standards, and any vehicle or operation that is human rated has to meet our health and medical technical standards. At the same time, the Human Research Program, which is managed out of JSC, is focused on understanding the risks, the health and medical and performance risks that happens during spaceflight, and the information they get from their research helps inform the standards. So the more they learn about what actually happens to humans in space, we can take that information and then frame standards to make sure that the requirements for spaceflight are being met. So having Health and Medical Technical Authority has been really helpful for the health and medical community. I think it has put a focus on the importance of the human in the loop in terms of engineering design and thinking about human health, medical, and performance issues perhaps earlier on in the development of a program and project, where perhaps historically at NASA sometimes the engineering always took the lead, and then they started thinking about, okay, how are we going to get it, how would the human fit in? So I think the development of Health and Medical Technical Authority and the shifting of the emphasis in the whole health and medical arena to a much more operational focus, I think in the long run has really been helpful to the agency, particularly now as we start to develop the vehicles and facilities and operations we're going to need for really space exploration.